I felt coming out of college, I had the basic knowledge, but I always found myself second guessing what I was doing, or I didn't feel as confident in what I was treating or assessing. And I wanted to learn more with assistance. So the residency program was able to give me and provide me a bigger depth of knowledge. My name's Emily and I'm a physical therapist. Becoming a full-time clinician for the first time, but then trying to go back to a hefty program was definitely a reservation of mine. But at the end of the day, I just wanted to gain knowledge and connect with other clinicians, and that was the priority. And so after watching another colleague go through the program and how confident that person came out of it as a clinician, I knew I had to do it. I felt as just a solo clinician, I wouldn't have gained that knowledge on my own, and the residency program definitely gave me the opportunity and resources to learn at a greater depth. It also allowed me to excel in my skills such as manual, assessment, and patient education. So unfortunately, with some of my experience in my DPT program, I had to go through COVID, so we didn't have the opportunity to learn a lot of hands-on skills. So the residency program gave me an opportunity to learn a lot more hands-on skills, manual techniques, practice with different clinicians. It also allowed me to expand my knowledge in research and ability to apply clinical prediction rules or learn how to treat different areas of the body, such as TMJ and spine, and fill in those blanks that I didn't get to excel in during undergrad. When I first started, I was very nervous, second guessing everything I kind of did, kind of double checking with my boss and colleagues, is this right, is this not right? So after the residency program, I walked away with a brand new feeling of confidence. I feel I'm able to educate and assess my patients without double checking or getting reassurance from somebody else, and I'm able to provide a complete and solid piece of treatment to everyone. Each instructor I felt was very supportive in their own way, whether it was meeting you where you were at, making sure to get patients on their schedule that you wanted to see, and even just life things. Everybody has a different perspective, everybody has a different background. They're all here with the main goal to help you succeed and advance as a clinician. Even just the good luck text on the way to exams, I felt extremely supported by them. They helped give me the confidence to where I was at and give that extra reassurance that you're going along the right way and you're getting to the main goal. Balancing the residency program and taking patients is a challenge. It's not easy, but it's doable. Managing your time is key, and talking to your director is also key. Originally, I was definitely stressed trying to get my notes done. PTSMC is here to support you as a clinician. They're currently using advanced technology to help make documentation a lot quicker and easier for clinicians. They recently started to use a certain AI system that helps you dictate and document your notes at a really quick speed. When considering the residency program, the technology that we use for documentation is certainly helpful and will certainly help you keep what you need to do in the clinic and use your extra time outside the clinic to study. Advice I would give is knowing your schedule and knowing how the clinic runs. If you know that you have a busy month or season, try to be on top of your residency assignments, and vice versa. If you know you have a residency assignment that's coming up or you're worried about studying for exam, talk to your director, talk to your scheduling team, and make sure that they're allowing you to have time in your schedule, whether it's longer time for evals or a little bit extra time for documentation, just so you all can support each other in your success. The residency program is a great way to connect to a lot of different clinicians within the company. You have your other residents that are with you through the program. We all come from different colleges and backgrounds, so it's exciting to see what they went through versus what you're going through. Also from different years. Me and one of the other residents were the same year, whereas a few others were a year below us. In addition, with all the mentors that you get to meet, you get to branch out and visit other clinics. You get to meet different clinicians that come in as guest speakers, so you really get to connect within the company and your different colleagues and clinicians. It was fun to bounce ideas off each other, learn from each other. You felt like you were working as a team versus a teacher versus a student and just trying to pass. It felt like everybody was there with the main goal to help you succeed and achieve your goals, and that was my favorite part of it. I would recommend the residency program to a person that is excited to learn and open to just expanding their skills as a clinician. It needs to be a person that is committed to knowledge and is willing to put the hard work in, because it is a lot of hard work. But as long as they are going for the goal of learning, they are certainly the person for the program. The residency program was worth it, in my opinion. I would say it would take maybe 5 or 10 years for me to gain the knowledge that I had through the residency program. Make sure you have a good plan to manage time. You are a full clinician while doing another program, so it is different than being in school. So just make sure you're able to handle both the time and energy to put into studying. If you're considering joining the residency program, don't be nervous. You have the span of knowledge after coming out of school, so it's just learning it at a deeper depth. So don't be nervous that you feel like you don't know anything. You do. You're just now going to completely expand that depth of knowledge and become a better clinician afterwards. If you're interested in joining PTSMC's residency program, visit ptsmc.com to apply.